May I hear a motion to dispense the calling of roll?
Madam Chair. Madam Chair.
Go ahead, sir. Kong Jun.
I move to dispense with the calling of the roll.
I second, Madam Chair.
There's a motion to dispense the calling of the roll, duly seconded. Is there any objection? Hearing none, the motion is approved. Would like to recognize first the presence of the following members, our co-chair, of course, and principal author of House Bill 6955, Representative Janette Garin. We have Representative Sean Acop, Representative, our Vice Chairperson, Representative June Gato, Representative Ditas Ramos. We do have Representative Adriano Ebcas. And from the minority, we have Representative Stella Kimbo. Ma'am Sylvia, can you recognize our resource person present today?
Yes, ma'am. For a while lang po, mama. For DOH, we have Dr. Beatriz Kiambao, Dr. Armando Tandok III of the RITM, Ms. Abasi, RITM, Attorney Nicolas Lutero of the Health Facilities and Services Regulation. We have ASEC Sharid Grande of the Health Regulation Team, ASEC Nestor Santiago of the Public Health Services Team, Mr. Laureano Cruz, of Director of the Admin Service, Ms. Esperanza Carating of the Personnel Administration Division, and Dr. Politico of the Health Human Resource Development. From the PhilHealth, they're not yet in, I think, ma'am. Who else? From the Philippine Hospital Association, we have Dr. Almora, the president. From the Philippine Medical Association, we have Dr. Jose Santiago Jr., the president of PMA. From the Philippine Foundation for Vaccination, we have Dr. Lulu Bravo, the executive director. That's all in my list, ma'am. I think we will update later po.
Thank you, Ma'am Sylvia. Good morning again, and welcome to the committee hearing of the DCC Subcommittee on Health and COVID-19 Response. Today, the Health and COVID-19 Response Subcommittee of the Defeat COVID-19 Ad-hoc Committee shall consider important measures that seeks to give additional benefits to our health workers and other frontline responders as we pay tribute to their gallantry and selflessness in the fight against the COVID-19 pandemic. On behalf of the committee and Speaker Alan Peter Cayetano, we fully support Proclamation number 976 of President Rodrigo Roa Duterte declaring the year 2020 as the year of Filipino health workers. The committee is also in solidarity with the World Health Organization in declaring the year 2020 as the International Year of the Nurse and Midwife, cognizant of their vital role in achieving sustainable development goals and universal care. I wish to emphasize with great pride that Filipino health workers have been also recognized in other countries, practically the world over, for their heroic deeds. The essential role of Filipino health workers and frontliners cannot be overemphasized. We cannot thank them enough for their sacrifices for humanity. We can only do as much to support them so that today, the committee hopes to find more ways to do so concretely with additional benefits and such other support mechanisms to aid them in the performance of their sacred duties while ensuring their safety and welfare, which would ultimately redound to the benefit of Filipino nation. To realize such objective towards meaningful legislation, the committee invited resource persons from government agencies like the Department of Health, PhilHealth, the DILG, the local government leagues, as well as civil society organizations, particularly health professional groups and institutions, among others, in the spirit of an all of government and all of people approach. First in the agenda for today are House bills providing hazard pay, special protection, and advancing the welfare of medical frontliners during public health emergencies, which includes House Bill number 6955 by Representative Janette Loreto-Gar, House Bill number 6660 by Representative Eddie Villanueva and Domingo Rivera, House Bill number 6695 by Representative Princess Rihan Sakaluran, House Bill number 6705 by Representative Eric Olivares, House Bill number 6750 by Representative Onyx Crisologo, House Bill 6755 by Representative Eric Yap, House Bill number 6796 by Representative Enrico Aumentado, by Representative Tonipet Albano, and House Bill number 6897 by Representative Yul Servon Nieto. The second item in the agenda are House resolutions expressing highest appreciation and profound gratitude of the House of Representatives to all healthcare workers and frontliners in the fight against COVID-19, which includes House Resolution number 836 by Representative Ron Salo, House Resolution 843 by Representative Baby Arenas, House Resolution 878 by yours truly, our Representative Helen Tan, House Resolution number 893, 894, and 895 by Representative Aleta Suarez, and House Resolution number 932 by Representative Yul Servo Nieto. The last item in the agenda would be a briefing by the Department of Health and IATF on the status of COVID-19 testing and laboratory capacity. The committee deems this very important in light of increasing COVID-19 cases as the country is gradually venturing out from community quarantine situations with the end in view that Congress may provide support to the executive agencies concerned. So before we proceed, the chair would like to recognize our co-chair, Representative Janette Loreto-Gar, for her opening remarks.
Thank you, Madam Chair. Thank you, ComSec. Before anything else, Madam Chair, I believe distinguished resource person have been with us since we started. The PMA president is with us, the Philippine Hospital Association. We thank them for their time. Our representatives from DSWD's Civil Service, ASEC Santiago, of course, the Filipino Nurses United, and the Philippine Foundation for Vaccination, all of whom took time to be with us this morning. Madam Chair, at this very time where everybody is also busy coining health and economy, it's very important for all of us to take care of our medical frontliners. The fact that many bills and many resolutions has been filed with the ultimate goal of taking care of our frontliners and health workers points to the huge concern not only among our executive officers but also among our legislators. Since without them, the direction of our country's response to this pandemic will be very difficult. With that, Madam Chair, allow me to thank all the other sponsors and all the other authors of various bills and resolutions filed to this effect. We in the minority has always been clear under the leadership, of course, of Minority Leader Benny Abante. We have always been clear that frontliners, especially the medical frontliners, are foremost treasures in this fight against this pandemic. With that, Madam Chair, allow me to inquire if I'll go directly to the, with regards to House Bill 6955.
Go ahead, Representative Janette.
Yeah. Thank you, Madam Chair. Distinguished colleagues, together with, in consultation with the Philippine Foundation for Vaccination, the Philippine Society of Pathologists, the Philippine College of Physicians, the Philippine Association of Medical Technologists, Philippine Hospital Association, and the Philippine Society of Microbiologists and Infectious Diseases, and of course the Philippine Nurses Association, I filed this act, which is actually providing for the protection and advancing the welfare of medical frontliners in the Philippines, appropriating funds therefore and for other purposes. I know that there are still other needs that our frontliners deserve. However, considering balancing what can be possibly available vis-a-vis what we have as the needs of our health workers, we tried to balance this in House Bill 6955. Our medical frontline health workers are actually the backbone of our public health systems, play a crucial role in delivering essential healthcare services, most notably on the local level as we seek to achieve universal healthcare for all Filipinos. Glaring also in this problem is the discrepancy between our privately paid medical health workforce vis-a-vis the government or the public pay medical health workers, simply because our hospitals, even in this time of pandemic, private hospitals are coping up with the losses, and they're absorbing most, if not all, of the impact of this pandemic. At present, we try to coexist with COVID-19 while waiting for a viable vaccine, but our medical frontline workers are also at higher risk of becoming infected with this virus. They selflessly put their lives in line during this health crisis, despite the fact that many of them are not vaccinated with flu and pneumonia. COVID-19 continues to challenge our current public health systems in a way we never thought we would be witnessing in our lifetime. And this extraordinary time has sowed human suffering, crippled the international economy, and shattered our normal way of life. Despite the uncertainty, our medical frontline health workers are working very hard without enough supplies or PPEs, thereby risking their lives just to combat this threat. Our experiences on past epidemics provide that our healthcare workers are at much risk of a higher risk of infection than the general public. During the SARS epidemic, healthcare workers accounted for 1/5 of infections